Every time you've had your blood pressure checked, you've seen two numbers, one on top and one below. You might have glanced at them quickly, heard your doctor mention them, and moved on. But these numbers, while simple at first glance, tell an important story about your heart, your arteries, and your overall health. The top number is called systolic pressure, and the bottom number is diastolic pressure. Systolic pressure measures the force of blood as your heart contracts and pushes blood into your arteries. It's the peak pressure with each heartbeat. Diastolic pressure measures the pressure in your arteries when your heart rests between beats, essentially the calm in between the pulses. Both numbers give useful information, but as we age, research has shown that one number becomes particularly important in understanding cardiovascular health and overall well-being. Why these numbers matter after 60. Blood pressure changes naturally as we age, because our arteries undergo subtle changes over time. The walls of our arteries gradually stiffen, which affects how blood moves through the body. This is why older adults often notice that their systolic pressure, the top number, tends to rise, even when their diastolic pressure remains relatively stable. Understanding which number reflects your risk most accurately is crucial. For those over 60, systolic pressure carries more predictive value for cardiovascular events than diastolic pressure, making it a key metric to monitor and manage. Knowing this distinction allows older adults to focus their attention on the most meaningful measures of heart and vascular health. Systolic versus diastolic. Real-life examples. Consider two patients who illustrate the difference between these numbers. Margaret, a 73-year-old woman, maintained a diastolic reading of 70, which she was proud of. Her systolic reading, however, was 165. She believed she was doing well because her bottom number was normal. 6 months later, she experienced a stroke that altered her life, highlighting the importance of monitoring systolic pressure closely. In contrast, Robert, 68, had a diastolic reading of 95, but a systolic reading of 128. He was understandably concerned, but after a thorough evaluation, it was clear that his heart and arteries were healthy, and his overall risk was lower than he feared. These examples show how focusing on the right number, especially as we age, provides better guidance for protecting long-term health. The science behind aging arteries. Arteries are not rigid tubes. They are elastic and designed to expand and recoil with each heartbeat. This elasticity helps absorb pressure spikes and protects vital organs. When we are younger, our arteries are supple, keeping systolic pressure lower and diastolic pressure relatively higher. As we age, the elastic fibers in our arteries gradually degrade and are replaced with stiffer collagen, sometimes combined with calcium deposits or plaque buildup. When the heart pumps into stiffer arteries, the systolic pressure rises because the vessels cannot expand as easily. Meanwhile, the diastolic pressure may remain stable or even decrease slightly. This combination, known as isolated systolic hypertension, is very common in older adults and requires careful attention to maintain overall cardiovascular health. Why systolic pressure is the key number. Systolic pressure, the top number, represents the peak force your heart generates to circulate blood throughout the body. Elevated systolic pressure can increase the workload on your heart and stress the blood vessels that feed your brain, kidneys, and other organs. Over time, consistently higher systolic readings can contribute to gradual changes in arterial walls, prompting adaptations in the heart and potentially affecting organ function. While diastolic pressure remains relevant, the systolic number has been shown in multiple large studies, including the Framingham Heart Study and MRFIT, to be the most reliable predictor of cardiovascular events in adults over 60. Focusing on systolic pressure enables targeted strategies to maintain heart and vascular health as we age. Understanding isolated systolic hypertension. Isolated systolic hypertension, occurs when systolic pressure rises while diastolic pressure remains normal or decreases. This pattern is common in older adults due to arterial stiffening. It is not simply a benign part of aging. It reflects changes in vascular structure that affect how the heart and other organs function. Addressing isolated systolic hypertension helps protect against common age-related cardiovascular challenges, including heart strain, kidney function decline, and reduced brain perfusion. Understanding this pattern allows older adults to take proactive steps in collaboration with healthcare providers to maintain health and independence. Effects of elevated systolic pressure on the heart. When systolic pressure is higher than recommended, the heart has to work a little harder with every beat to push blood through the arteries. This increased effort isn't something you feel immediately, but over time it can lead to changes in the heart muscle itself. One common adaptation is left ventricular hypertrophy, where the heart muscle thickens to manage the added workload. While this thickening is a natural response, it can eventually affect how efficiently the heart fills with blood and pumps it out to the body. This can gradually reduce exercise tolerance and energy levels if not addressed. The good news is that by monitoring your systolic blood pressure and making thoughtful lifestyle choices, you can reduce unnecessary strain on the heart. Simple steps like staying physically active, maintaining a healthy weight, following a balanced diet, and working with a healthcare provider for personalized care can help the heart continue to perform efficiently as we age, ensuring that it supports a vibrant and active life. Understanding the relationship between systolic pressure and heart function allows older adults to be proactive rather than reactive, giving the heart the support it needs before subtle changes turn into noticeable symptoms. Effects on the brain. Systolic pressure doesn't just affect the heart. It has a meaningful impact on brain health as well. The brain is supplied by delicate blood vessels that are sensitive to pressure changes. Elevated systolic readings over time can place stress on these vessels, leading to minor microvascular changes that may accumulate quietly. These changes are often silent, meaning you may not notice them day to day, but over years they can affect memory, attention, and overall cognitive function. Maintaining systolic pressure within healthy ranges supports steady blood flow to the brain, which in turn helps preserve mental clarity, focus, and memory. There's also evidence that consistent blood pressure management can reduce the likelihood of stroke or other complications, which becomes especially important as we age. Lifestyle strategies, including regular aerobic exercise, a heart-healthy diet rich in vegetables and whole grains, and stress management practices, can help maintain both cardiovascular and cognitive health. When combined with guidance from a healthcare professional, these habits empower older adults to protect brain function and sustain independence well into later years. Effects on the kidneys. The kidneys play a critical role in filtering waste from the blood and balancing fluids, electrolytes, and blood pressure. They are supplied by tiny, sensitive blood vessels that can be affected by sustained high systolic pressure. When these vessels experience elevated pressure for prolonged periods, kidney function can gradually decline. This isn't something that usually causes immediate symptoms, but over time, it can contribute to subtle changes in fluid balance and overall health. If kidney function begins to decrease, it may also contribute to further increases in blood pressure, creating a feedback loop that can be managed effectively with timely intervention. Controlling systolic pressure through lifestyle modifications, monitoring, and medication when needed helps support kidney health and overall metabolic balance. By taking proactive steps, older adults can maintain kidney function, support daily energy and well-being, and reduce the risk of long-term complications that could affect quality of life. The role of diastolic pressure. Although systolic pressure is often prioritized in adults over 60, diastolic pressure, the bottom number, is still important and provides context for overall cardiovascular health. Very low diastolic readings, especially when paired with elevated systolic readings, can indicate a wide pulse pressure, which reflects arterial stiffness. In these situations, the heart may not receive optimal blood flow during its resting phase, which can subtly affect heart function. Maintaining a balanced view of both numbers allows older adults to work with their healthcare providers to create a comprehensive approach to blood pressure management. In practice, this means focusing on lowering the systolic number while keeping an eye on diastolic readings, ensuring that treatment strategies support heart, brain, and kidney health without causing undue strain. Guidelines for systolic blood pressure. Guidelines from major cardiovascular organizations emphasize the importance of monitoring systolic pressure, particularly in older adults. A reading of 130 mm Hg or higher is generally considered elevated, and the primary goal is to bring that number down safely and consistently. For healthy seniors, some studies suggest that aiming for a systolic pressure below 120 mm Hg can provide additional benefits, while for older adults with multiple health conditions, slightly higher targets may be more appropriate to avoid unwanted side effects. Discussing individual goals with a healthcare provider allows for a personalized plan that balances safety with effective blood pressure management. Understanding these guidelines helps older adults make informed decisions about lifestyle choices, monitoring practices, and when to seek medical guidance. Lifestyle measures for systolic control. Lifestyle changes form the foundation of managing systolic pressure and are beneficial for overall cardiovascular health. Reducing sodium intake is one of the most effective measures, particularly because many people consume more than double the recommended amount. Simple strategies like reading labels carefully, avoiding processed foods, and limiting added salt can make a meaningful difference. Maintaining a healthy weight is another key factor, as modest weight loss often results in measurable reductions in systolic readings. Regular aerobic activity, such as brisk walking, swimming, or cycling, strengthens the heart, improves arterial flexibility, and supports overall circulation. Limiting alcohol intake and incorporating stress management practices, like mindfulness, deep breathing, or yoga, can further help stabilize blood pressure. These lifestyle strategies are practical, accessible, and highly effective, particularly when combined with medical guidance for those who need additional support. The role of medication. While lifestyle changes like diet, exercise, and stress management are incredibly important, many adults over 60 find that these adjustments alone aren't always enough to bring systolic blood pressure down to a safe range. In these cases, medication becomes a key tool for protecting long-term heart, brain, and kidney health. Blood pressure medications are safe and effective when used thoughtfully and monitored regularly, and there are several classes to know about. Diuretics help the body remove excess fluid and sodium, which can lower blood pressure. ACE inhibitors and ARBs work on the hormones that control blood pressure, easing the strain on the arteries and heart. Calcium channel blockers relax the blood vessels and reduce the force of the heart's contractions, while beta blockers help the heart beat more slowly and efficiently. It's not uncommon for older adults to take 2 or even 3 of these medications at the same time, and this is standard practice rather than a sign that something is wrong or that a person has failed at managing their blood pressure. The key is working closely with a healthcare provider to monitor response, manage any side effects, and adjust therapy as needed. When medication is combined with healthy lifestyle choices, older adults can maintain energy, protect organ function, and reduce the long-term risks associated with elevated systolic pressure. Taking medications consistently, understanding how and when to take them, and having open communication with a provider are all part of a collaborative approach that allows older adults to live actively and confidently. Home monitoring and consistency. Measuring blood pressure at home is one of the most effective ways to understand how your body responds to lifestyle changes and medication. Office readings can be helpful, but they only provide a snapshot of your blood pressure at a single moment, and they may not reflect what your pressure is like throughout the day. Some people experience white coat hypertension, where pressure spikes in the clinic due to stress or anxiety. Others have masked hypertension, where readings at home are higher than what is measured by their doctor. By tracking readings at home, older adults gain valuable insight into trends and patterns, which helps both them and their healthcare provider make informed decisions about treatment. Using a reliable monitor, taking measurements at the same times each day, and recording the results in a notebook or digital app allows you to see progress over time. Consistency is equally important with medication. Skipping doses or taking medications inconsistently can cause fluctuations that are actually more stressful for the heart and arteries than a steady, slightly elevated pressure. By monitoring at home and adhering consistently to prescribed medications, older adults gain control over their blood pressure and lay the foundation for long-term cardiovascular health. Addressing common misconceptions. Many older adults believe that high blood pressure isn't a concern if they feel fine, or that it is simply an unavoidable part of aging. In reality, elevated systolic pressure often develops slowly and quietly, without obvious symptoms, but it can affect the heart, brain, and kidneys over time. Waiting until symptoms appear is not the best strategy, because damage can accumulate long before you notice any warning signs. Some people point to relatives or friends who lived long lives with untreated high blood pressure as evidence that it doesn't matter. This is an example of survivorship bias. There are countless others who may have experienced strokes, heart attacks, or kidney complications because their blood pressure was unmanaged, but their stories aren't heard. Recognizing that blood pressure can be managed and that proactive intervention improves quality of life empowers older adults to take control rather than leaving it to chance. By combining lifestyle measures, regular monitoring, and medication when necessary, seniors can maintain independence, energy, and long-term well-being. Practical steps for older adults. Older adults can take concrete, actionable steps to keep their blood pressure in a healthy range. The first step is simply knowing your numbers. Regular blood pressure checks at home or in a clinic provide the data needed to take action and make informed decisions. The second step is to focus on the systolic reading, particularly if it exceeds 130 millimeters of mercury, while keeping the diastolic number in context. Third, implement lifestyle strategies that have a direct impact on systolic pressure. Reduce sodium by avoiding processed foods and being mindful of added salt. Maintain a healthy weight, as even modest weight loss can meaningfully lower systolic pressure. Engage in regular aerobic exercise, like walking, swimming, or cycling, which strengthens the heart and improves arterial flexibility. Limit alcohol intake and incorporate stress-reducing practices such as deep breathing, meditation, or yoga. Fourth, if prescribed medications, take them consistently and communicate openly with your healthcare provider about any side effects or concerns. Fifth, monitor blood pressure at home and keep a written log of readings. This allows you and your provider to track trends, make adjustments, and identify patterns that could affect treatment decisions. Finally, schedule regular follow-up appointments to ensure your plan continues to meet your evolving health needs. By following these practical steps, older adults create a structured approach that empowers them to manage blood pressure effectively and maintain overall wellness. Empowering yourself with knowledge. Knowledge is a powerful tool for managing blood pressure and overall cardiovascular health. Understanding systolic pressure as the critical number for adults over 60 changes how you approach daily habits, lifestyle choices, and medical care. Learning about how arterial stiffening occurs with age how the heart and kidneys respond to pressure changes, and how systolic management impacts cognitive function, equips older adults to make informed decisions. Knowledge alone isn't enough. It becomes empowering when paired with action. Whether it's incorporating more exercise, making dietary changes, adhering to medications, or having informed discussions with your healthcare provider, each choice contributes to long-term health. With the right knowledge and consistent action, older adults can preserve vitality, maintain independence, and enjoy a better quality of life for years to come. Real-life lessons. Patient experiences often illustrate the principles of blood pressure management more clearly than numbers alone. For example, consider Margaret, who focused solely on her diastolic pressure, while her systolic number remained elevated. Over time, the unchecked systolic pressure contributed to health complications that could have been mitigated with earlier intervention. On the other hand, Robert's story shows the value of comprehensive evaluation and context. While his diastolic pressure was higher than he preferred, his systolic readings were well managed, and he was reassured by a thoughtful care plan that included lifestyle guidance and monitoring. These real-life lessons demonstrate that understanding the systolic number, taking proactive steps, and combining lifestyle strategies with medical guidance creates a meaningful impact on long-term heart and organ health. They also show that knowledge plus consistent action is the most effective way to maintain wellness. Conclusion: prioritizing systolic health. For adults over 60, the systolic number, the top reading on a blood pressure measurement, is the most important to monitor, manage, and discuss with a healthcare provider. Elevated systolic pressure often reflects natural changes in the arteries that occur with age, but it is also modifiable through lifestyle, medication, and regular monitoring. Taking proactive steps to manage this number helps protect the heart, brain, and kidneys, supports overall vitality, and contributes to sustained independence. Knowledge alone is powerful, but informed action transforms risk into manageable care. By understanding systolic pressure, actively monitoring it, following lifestyle measures, and adhering to prescribed medication, older adults gain a clear path to maintaining health, preventing complications, and preserving quality of life as they age. Prioritizing systolic health empowers older adults to take control of their well-being, make confident choices, and enjoy years of active, fulfilling living.